Welcome back to a brand new season of Under One Roof. I'm your host, Dr. Tom Simcock, and I'm thrilled to have you join us as we embark on an exciting journey exploring the multifaceted world of housing and health. As we launch this new season, we're expanding our horizons to delve into a broader range of topical issues that affect not just our homes, but our communities and society at large. In this episode, I'm delighted to welcome Faye Sanders from the University of Bath to discuss epigenetics, housing and health. This is such a fascinating topic and I'm looking forward to this discussion. So thank you for tuning in, and let's get started with this exciting new chapter of Under One Roof. It's a pleasure to have you here on the podcast, Faye. Could you please just take a moment to introduce yourself to our listeners?
Yeah, of course. So thanks very much for having me. I'm very excited to kind of talk to you today about the research and everything. So my name's Faye Sanders. I'm currently based at the University of Bath, kind of within the Department for Psychology. So my background is kind of primarily in psychology and mental health. So I did my undergraduate here at Bath, actually, which I finished kind of last year. Just started my PhD here. I also kind of, whilst I was doing my undergraduate, I did a placement at the Institute for Housing and Urban Research at Uppsala University in Sweden with Terry Hartig. So that was kind of quite formative for me, I guess. And yeah, I'm really interested in links between housing and health and urban health more generally as well. So yeah, that's kind of a brief background into me.
Really interesting, and that sort of must have been a great experience to work with Terry Hartig in Uppsala as well.
Yeah, that was really cool. I felt really kind of grateful for his expertise on housing. And yeah, it was really great to work in that environment because there's a lot of different disciplines actually over at IBF, lots of geographers and economists and everything. So it's really interesting to have that experience. Yeah.
Part of the research we're looking at is around the sort of epigenome work that you've been undertaking. Could you share your sort of background and how you became interested in the sort of the home and the epigenome connection?
Yeah, so this is actually something that I've kind of been personally reflecting on recently. And to be honest, like, I think it kind of starts all the way back at school for me, which is actually quite nice to reflect on. So I remember kind of went to school in the Greater Manchester area, and I had a really great geography teacher. And human geography, we were learning about the human crescents, actually. I think it was specifically this kind of case study of housing and the impact that it had on people. And that was kind of the first interaction that I had with housing. And at the same time, I guess, as learning all of that, I was also kind of doing my biology A level and learning about these processes like epigenetics, kind of coming across them for the first time. And we kind of learned about them in the context of diet and, pollution. I just couldn't really help but wonder whether, people's experience of the physically built environment had any role to play in that. So that was kind of where the interest came from. And then I was kind of fortunate enough to go to University of Bath. And I remember having a meeting kind of in the first few weeks, actually, of joining, just, getting to know your personal tutor and everything like that. And I kind of, probed him a bit on epigenetics and said, is there any kind of research going on in the department looking at this, or is anyone looking at housing and things like that? Anyway, so he said, well, we've got Esther, who's kind of, very interested in epigenetic processes. And, he was, I really appreciate that he set up a meeting with us, and we talked it through. And Esther was very, very supportive, and kind of enabled me to, listen to me and listen to my ideas, and said, yeah, it sounds really interesting. Why don't we kind of go on this journey together? So I had a very, very fortunate experience there where, I kind of was able to share the thoughts that I was having. And from there, we kind of set up this research team. So that's kind of the journey of where it came from.
One of the latest, was it a paper or a report? Was that with Harvard medical school colleagues as well?
It was indeed. So Esther kind of has a great network of individuals and teams that she works with kind of all over the world, really. One of those teams, which is very interested in kind of epigenetic processes, is the team at Harvard. And they have been, again, incredibly supportive of the work that we've been doing. It's quite complicated analyses that at the time starting university was quite challenging. And so they were really able to kind of help me out there. And yeah, it's a great team, and they're also doing some kind of great work on, epigenetics and the different environmental factors associated with that. So, yeah.
I think just before we get into some of the real sort of grisly details around epigenetics, it is quite a complex topic. And how would you explain it to someone who's completely new to what we're talking about?
Yeah, for sure. So I guess what I typically would describe it as is we're all kind of born with the same genes, and they stay the same throughout our entire lifetime. But kind of what changes about those genes across our lifetime is the way that they're expressed. So one of the biological processes that kind of has some kind of control over that process is epigenetics. And basically this refers to, tiny chemical groups bonding to our DNA, and they play a role in whether those genes are then, you might have heard the term, kind of whether those genes are turned on or off. And so epigenetic processes are influenced by kind of both our genetics, so the genes that we're born with, but also kind of our environmental factors, such as housing, for example.
I think a part of the work that you've been doing is looking at the sort of the link between the environment, the epigenetics, and then the links with like depression. Is there anything you'd be able to say about that as well in terms of those different links?
Yeah, definitely. So we're only just really starting to understand the relationship that epigenetics plays in mental health. But there are kind of numerous studies looking at associations between our epigenome and our mental health. So a lot of the work that we've done, for example, has been on depression and ADHD, but there are plenty of other kind of, experiences of mental health that DNA methylation and epigenetics has kind of been associated with.
You use that term DNA methylation. Is that process of the switching on and off of?
Yes, exactly. Sorry. So this is kind of like the example of a chemical group that can kind of join onto our DNA and is part of that epigenetic process. Yeah.
Lots of different, as a housing researcher, quite different sort of terminology to sort of get your head around and from all this.
Definitely. Yeah.
For your study, what are the sort of the key methods that have been used?
Yeah, so we were fortunate enough to kind of have this data set called the Avon longitudinal study of parents and children. And this really is quite a large scale study that was conducted in the southwest of England. So for those who are kind of familiar with the area, it's kind of the Avon area, so around Bristol, places like that. And basically, there's loads of different variables collected about this particular cohort. For those who might have heard of it, it's very, very in-depth, and it's kind of a brilliant resource. And basically what we wanted to test was whether people's experiences of poor housing quality associate with symptoms of depression. And we did this in the Avon longitudinal study of parents and children, abbreviated to ALSPAC. We tested this in the ALSPAC mothers. as well as kind of testing the relationship between poor housing quality and depressive symptoms over kind of various different time points. We also tested whether this was partly explained by DNA methylation. So another kind of huge advantage, I guess, of the Auersbach data is that it has both, vast amounts of information about housing and mental health, and critically DNA methylation. So this is kind of taken from people's blood samples. So with this is secondary data analysis. So we didn't actually conduct any, primary data collection ourselves.
For that data set, what was the time period? How long it was collected over?
Yeah, so it was quite a long period of time, actually. So we kind of had two different analyses that we looked at. The first was kind of just testing whether poor housing quality that people experienced was able to predict depressive symptoms at that same time point. So the mothers were kind of aged around 30 years at this point. And then the second kind of part of the study that we were interested in was whether poor housing quality experienced at this first time points around 30 years was then able to kind of predict depressive symptoms around 18 years later, so quite a significant amount of time. And we found that indeed both kind of periods of time were able to predict depressive symptoms.
That's really interesting. And you discussed the link with housing quality. How was housing quality defined and measured in your study?
Yeah, so I think for me, this was actually a really interesting part of, the research process, is actually kind of, defining housing quality and looking at all these kinds of variables that we have with housing and trying to kind of produce this score. I think that was really interesting. So the way that we kind of decided to do it was we had kind of a composite score that was kind of composed of multiple different constructs to do with housing quality. So this included, for example, kind of damp condensation or mold within the home. So some negative aspects, but it also included some positive aspects such as access to outside space, whether there'd been any kind of modifications to the home, which was quite interesting. So, for example, whether there'd been new carpet or new wallpaper, new furniture. We also had constructs in there to do with the size of the home, the temperature of the home during the winter, so how low the temperature got, and also critically the mother's kinds of feelings about her home. So how satisfied was she with her home? And yeah, so we weighted all those variables equally. So we kind of didn't give any one variable more kind of importance over the other. We kind of kept them all the same to kind of construct this poor housing quality score.
I mean, that's sort of really interesting in terms of all those different constructs. And I wonder, have you thought about just looking at those constructs and sort of trying to expand it or develop that housing quality sort of construct?
Yeah, definitely. So this is kinds of conversations that we're having now, really. It really was quite an interesting part of the process, and one actually that we found really quite kind of defines the study, which was quite interesting. So conversations and questions that we're kind of going through at the moment, for example, are whether we decide to kind of deconstruct this construct and see, for example, what specific constructs are contributing more, for example. The reason why we didn't do that, I guess, originally is because, even though our sample size is quite large, it was around kind of 9,500 mothers, which is quite a significant amount. It's still not hugely representative of the UK. So I guess if we were to kind of repeat this and replicate this in a larger sample with larger age ranges and things like that, we would definitely want to kind of deconstruct that further and actually kind of unpick it even more, because that in itself is a hugely interesting component.
Getting into some of probably really interesting bits is what are some of those key findings from your research regarding the impact of sort of housing conditions on epigenetics?
Yeah, so I guess this was a super exciting part of the project. And we found that kind of at both kind of mid-adulthood and kind of early adulthood and mid to late adulthood, we found that DNA methylation kind of was associated with both housing quality and depressive symptoms at both of those time points. And we found a number of sites along the genome which were kind of identified with this, which was very, very interesting. And some of the sites that were identified had previously been associated with mental health kind of pathways, including pathways, kind of biological pathways of depression. So that was kind of super interesting to see those links there. I guess another interesting component to that was we didn't see any overlap in the genes kind of identified between these two different time points that we tested at. So it seems to be that there are kind of different pathways going on at different time points, which is something which is, to be honest, quite consistent with what we see in other research looking at kind of pathways of depression across the lifespan.
That's really interesting, cool type of research to and methods being used, I suppose, in a sort of housing context. And do you think that this has maybe helped broaden sort of the reach of the findings in how it's been communicated and sort of the media coverage it's received as well?
Definitely. So again, I guess this is something that I've been reflecting on, over the course of this project, and especially kind of when we're, kind of putting it out in the media and things like that. So I think definitely, first of all, I've been able to share these findings with audiences outside of your kind of typical housing research realm, which has been really, really interesting. So I've been able to share it with, psychiatrists and things like that to really kind of share the importance of housing and considering housing in promoting kind of population health. And yeah, I guess in terms of kind of the reach of policy, I think it's definitely been a component of the research which has led to receiving increased coverage. And, I think maybe perhaps that's expected because biological evidence can be a bit scary and it can be quite shocking, but we're always kind of very aware of the fact that there are, decades of research, fantastic research already been conducted showing, associations between housing and health and the importance of considering housing for health. And, our research is only kind of a splash in the ocean, when you kind of look at the whole picture. But we're really pleased to see the impact that it has had. And hopefully we'll kind of continue to have when we, continue sharing the findings.
Do you think that maybe policymakers are more likely, as you said, it's sort of quite scary being, that biological evidence rather than the more sort of qualitative research that's more typical in our sort of housing sphere. So do you think maybe policymakers are more likely sort of taking notice of the findings?
I think definitely. That's definitely something that I, hope for. Biological evidence, being able to quantify impacts sometimes can lead to, greater kind of policy changes. We've seen that, for example, the effects of air pollution and health, and hopefully we can kind of continue to really demonstrate the huge effect that housing can have on people's health, both physically and mentally, because, I guess the additional aspect that this biological evidence brings in is the impact on physical health. And so I guess by incorporating both the impacts on mental and physical health, you can kind of extend that reach to really kind of generate the policy change that's needed.
you sort of touched on it a little bit about, continuing to share findings as they come out. So what are sort of those next steps for this research?
Yeah, definitely. So we are repeating this kinds of study, but we're going to be doing it in children and adolescents. So that'll be super interesting to kind of see how these relationships occur kind of in childhood and adolescent health. So that'll be super interesting to maybe compare and see differences. And, that period of time is a lot more dynamic. So it can be very interesting to look at health during that period and to see kind of the impacts that housing can have on children as well. I guess another kind of future avenue of research is that along with our kind of colleagues, Amy Clare, and the work that she's done, really good work on housing and epigenetic age. So how kind of housing relates to people's biological ages and how fast we're aging. That's another avenue of research that our team are currently working on together. So yeah, these are kind of things to be looking out for.
We will definitely keep a lookout for those pieces of research. And it's sort of great to see different research approaches being applied in housing, especially in promoting that profile of housing and health research and taking it up the agenda. You mentioned earlier that you're currently studying for your PhD. What is the focus of your PhD?
Yeah, so I've started my PhD also at the University of Bath. They're struggling to get rid of me at the moment. I'm based at the APS Centre for Doctoral Training, which is kind of focused on creating kind of sustainable mobility and achieving kind of clean, sustainable mobility and things like that. So I guess part of my journey there was realizing that I found it very hard to look at housing in isolation. I was considering housing, but I was finding it hard to kind of, ignore the other factors that kind of housing is, part of a huge system. Now, as part of my kind of journey on this PhD, we've been doing a lot on kind of systems thinking and how processes interconnect. And it's been absolutely fascinating, to be honest. And so part of my journey there is now trying to consider housing in a much broader system. The study looks at housing and kind of the interior features of housing and, housing quality inside the home. But now I guess my focus will be broadening up to, where is that housing actually located and what services and infrastructure does it have access to? And how does that affect people's health? So, for example, does that mean that they have more access to active travel infrastructure? And things like that. And are they able to exercise more and make more use of green space outside their home? So really quite taking a shift, really. Still obviously looking at housing and health and mobility and everything like that. But really taking a broader perspective on it and looking at kind of, where are the homes actually located and what do people have access to? And things like that.
It sounds absolutely fascinating, and I'm sure there'll be lots of great things coming out of the PhD as well.
Yeah, no, it's going to be very, very exciting. Lots more to research and to keep going on.
Well, I want to just say absolute thank you so much for joining us on the podcast today, and it's been absolutely fascinating talking to you about all these cool topics around DNA methylation and epigenetics. It's an absolutely fascinating area and avenue of research. So thank you so much for joining us today.
No, thank you very much. It's been really nice to chat about it. And thanks so much again for having me on. It's been really good.
So that is the end of this episode of Under One Roof. Thank you again to Faye. It's been a fascinating discussion about epigenetics and housing, and I've really learned a lot about this really cool new approach that's been taken to really link housing and health. together. As we wrap up this thought-provoking episode, we want to thank you, our amazing listeners, for continuing with us on this journey. Stay tuned for further discussions exploring a broad range of issues, including housing and health policy, the private renter sector, and the role of different public sector bodies in housing and health. Thank you again for joining us on Under One Roof, and we can't wait to continue this conversation with you in the next episode.